Hello, welcome to Red Pill, Blue Pill. I'm Emily Reinhardt, student physical therapist with College of St. Mary's in Omaha, Nebraska. For several videos, we've been covering the opioid epidemic, what is pain, and what are common methods of management and healthcare for pain conditions. But today, and right now, I'm going to discuss how a PT evaluates pain and what approaches a PT may take in this process. Physical therapists are uniquely positioned to be able to listen and evaluate your complaints of pain. The process may vary from office to office, but it usually follows a common set of steps. Typically, you'll be given some forms to fill out in the waiting room. These forms have questions on them that just help us as therapists get a large overview of how your pain is impacting your daily life. They're also helpful to compare to later down the road to see where progress is being made or if we need to change anything in the treatments. In your one-on-one time with the therapist, they'll likely ask you several questions. These questions are designed to help the PT identify key features about the pain you're experiencing and how it's impacting your life. These questions will also help rule out if there's anything emergent or serious going on. This is a very rare occurrence, but a PT will seek to be as thorough as possible. During the exam, your PT will work on figuring out the nature of your pain so that we can develop appropriate treatment strategies. They may also spend time providing some education on what they're finding and how and why the brain is reacting the way that it is. Your PT may decide to do several tests on different body segments and joints, or may only do a few. This depends on what the therapist finds out during the initial part of the exam and if they feel like performing more complex assessments or many assessments has the potential to cause your pain to flare up and increase to unmanageable levels. Physical therapists are supposed to be able to spend the time and attention with you to assess and determine the impact your pain has on your daily life and educating on strategies to begin to what we call downregulate or calming the central nervous system and brain to decrease the pain you're experiencing. Remember, many times when we have chronic pain, it's because the brain is just kind of freaking out and is just constantly tense. We want to calm that down. Your PT will also be looking to see if a referral to another provider may benefit you, such as a massage therapist, acupuncturist, or even a psychologist. Remember, pain is what we call a multi-system response. It's not just caused by one singular structure or event, but a mixture of signals being sent to the brain that it then chooses to interpret, which means you may benefit from what we call a multidisciplinary approach. That is, a few providers all working together for your good. Depending on their findings, the PT may choose to give you a home exercise program to begin at home that day. This can include exercises to strengthen muscles or activities to simply retrain the brain to be able to better interpret signals that it's receiving from the body. Just as you as a person are unique and your pain is unique, each evaluation by a PT will be unique. Each therapist might do something different or similar to the steps outlined above, but each will also listen to your complaints and seek to determine the best way to address your pain and how it's impacting your life. In our next and final video, I'm going to outline some of the interventions that therapists have to be able to use to treat the pain conditions that you may know and so that you may know what to expect or can ask your therapist about.